AI is starting to influence what patients read before they ever choose a dentist, but most clinic content still is not aligned with how patients actually search. Over the past year, I have been reviewing a lot of dental websites and Google business profiles across the US, and one pattern keeps showing up. Clinics are putting time into content, but that content often is not what patients are actually looking for. Not because the information is wrong, but because it's written from a clinical perspective, not from a patient search perspective. For example, a clinic might describe a service as comprehensive endodontic therapy, but patients aren't searching that way. They are searching tooth pain, root canal near me, or emergency dentist open now. There is a disconnect between how clinic describe treatments and how patients try to find them. This is where generative AI is quietly changes the landscape, not by replacing expertise, but by helping translate clinical knowledge into patient-friendly language. What I have been seen working in real clinics is this. First, content that mirrors how patient actually describe symptoms tends to show up more consistently in local search, not just on website, but also within Google Business Profile content and service descriptions. Second, consistency matters more than volume. A few well-aligned pages or posts written in patient language often outperform large amount of generic content. And third, AI can help identify gaps that clinics don't usually notice. For example, questions patients are asking but the website never answer, or services that are offered but not clearly explained in simple terms. The goal here is not to produce more content. It's to produce content that align with how patients think, search, and decide. Because ultimately, patients don't choose the most technical explanation. They choose what they understand and trust. As AI continues to shape how information is surfaced, it is worth asking, is your current content written for your peers or for the patient trying to find you? If you are exploring how AI can improve how patients discover your clinic, it may be worth testing how your current content aligns with real patient search behavior.